Hi there, I'm Sonal Mehrotra Kapoor. You're watching me on NDTV. Now, there's so much of bad news going around, so I thought let me bring you some good piece of news today. Now, if there is one thing that India really needs right now, what is it? It is vaccines more and more. That is our only way out of this pandemic. And guess what? We are now gearing up for the third vaccine to actually arrive in the country. We're talking about Sputnik V, the Russian vaccine, one of the first to be developed in the world and has lots of things that are way better in a way, if not at par with what we already have in the country. So today in this video, I will bring you a head-to-head comparison of the Sputnik V versus what we have in the country already, that is Covishield and Covaxin. First up, let's talk about the technology. Now, Sputnik V uses something called an adenoviral-based vaccine, which is a weakened form of the virus that is then injected in your body, and then your body mimics that immune response and builds antibodies against COVID-19. Now, this is the same technology that is used in Covishield, the Oxford AstraZeneca vaccine as well. But Bharat Biotech is actually different when it comes to its tech, because what they do is they use an inactivated vaccine, which is basically they pick up a COVID strain, make it chemically kill it, and then inject it in your body. So it's a little bit of a difference in that tech. But other things, let's talk about that. Doses. All three are 2-dose vaccines. But Sputnik V has something fascinating. It actually has two different formulas for its first and second jab. Okay, so this is not there in any other vaccine now. Sputnik says this is actually done so that it boosts your immune system even further. How? They say that instead of using the same version of the vaccine 2 times, say in Covishield 2 jabs, Covaxin 2 jabs, in Sputnik, they put in 2 different formulas in your body, and this has proved to be having better effect on your body. It has a better efficacy. It makes it safer, and also the reactions that you get to vaccine, this is much less in this. This is what Sputnik claims. Now, both these jabs in Sputnik, the 2 different formulas that they use are given at a gap of about 21 days. For Covishield, remember, now the revised is that both the jabs have to be given between a difference of at least 6 to 8 weeks. Some doctors say take it after 10 weeks also. That is when Covishield has its best efficacy. And Covaxin, of course, you know, is 28 days. And then efficacy, the all-important question here, well, this is where Sputnik V really scores above the rest. Sputnik is one of the only 3 vaccines in the world which have an efficacy of over 90%. It has an efficacy of 92%, and it is deemed to be safe and offer complete protection against hospitalization and death as well. Now, against the other 2 vaccines, AstraZeneca, Covishield, that has an efficacy of roughly 70%, 72% over there sometimes. And Bharat Biotech, Covaxin, though it has not been peer reviewed, their own claim is that they have an efficacy of about roughly 80%. Now, when it comes to storage, let's look at that. How easy is it to store? Now, all 3 vaccines can be stored at the refrigerator levels. But again, Sputnik has a bit of a surprise over there. Sputnik is actually not just conducive for India because it can be stored at refrigerator levels. It is actually a freeze-dried vaccine. Now, what does a freeze-dried vaccine means? That means it comes in powder form. This powder form is then hydrated and then put inside of you. Now, what does it do? This powder form means that the formula of the vaccine is very stable, much more stable than what you have in the other vaccine. They are also stable, but this is said to be, in technical terms, it has an edge over the others. And then it also improves the storage life and the shelf life of the vaccine. This is where it is a major hit and a tick against the others. But then let's tend to the other important questions here. The most pressing bits when it comes to the vaccine here in the country in middle of such a massive second wave. will it work against the new variants, the double mutation? Will it work against the South Africa, UK variant and all of that? In that, now the thing to remember here is that there has been no study that backs the claims of all these vaccine manufacturers when they say that this will work against the variant or not. There has just not been enough time for all these studies to actually be performed and come out with a report on this. But let's tell you what they claim. Okay, currently on the face of it, all vaccines are supposed to work against all variants. But in Sputnik V's case, by their own claim, they say that their response to the South African variant is not very strong. But when it comes to the UK variant, they claim they are the best in the world. They say this has been backed by some studies and clinical trials that they've done and what they've performed across the country. Now, cut to Covishield and Covaxin. Covishield, Adar Poonawala spoke with NDTV and he said that against the UK strain, it is bringing down the level of hospitalization and death. That basically means it will not give you 100% protection or 100% a lot of efficacy against the UK strain, but it will bring down the thing. So the stage of hospitalization and death is drastically brought down. But remember, when it came to the South African strain, South Africa had sent back 1 million AstraZeneca Oxford Covishield jabs to India saying it doesn't work in our case. In Covaxin again, we don't know, there is no data, but ICMR has given a statement saying that Covaxin does work against the UK strain. Now, double mutation, will it work against that? Well, that's the key question. But like I said, there is no data available on this. But when I spoke about this to the best virologists in the country, they are telling me that over a period of time, COVID is likely to become like, say, H1N1 and other viral diseases, which means that there will be new strains coming up at regular intervals in years to come, really. And that means that we will require to have updated vaccines year on year. So the key thing to remember here for everybody is that don't wait that a better vaccine will come and I will get that jab. No. You have to take whatever is available right now because that is the only solution to cutting the chain of infection. That is the need of the hour. Once you take all these vaccines year on year, one, what you do is you really bring down the level of infection, the level of sort of virus strain that you will have in your body. And as the time develops, we will see whatever is to be done. But don't, all these details that I'm giving you right now, don't for a minute think that, oh, let's wait for Sputnik, let's wait for Johnson & Johnson, let's wait for Pfizer and Moderna to come in. That's not the solution here. You really have to take what is available right now. Also remember, technically, this will keep mutating. There will always be a new mutation that will come up. That's how viruses are by nature. So it is important right now to ensure that you are safe, especially when the peak is going on. Now, let's talk about the cost. Well, cost is something that the government decides mostly, but Sputnik V at the moment says that they will be giving it to India. At the moment, we don't know what the negotiated rate is, but I spoke with the CEO of Sputnik V and they said it will be about $10 per dose. That is what they're giving it to the rest of the world as well. So let's see what comes out of that. And then timeline and productivity, because that really is the real thing that will be required right now. How soon can we have it? Well, you know that Covishield is produced by Serum Institute in India, so it's a manufactured in India vaccine. Covaxin is made and even it was developed here. That means it is a made in India vaccine. Now, Sputnik V also is currently tied up with not one, not two, but at least 3 different pharma companies we know. And they will be working at different levels to try and get their production up. And at the moment, the last I spoke with the CEO of Sputnik V, he told me that a minimum of 200 million doses is what they are working on. And that is just one manufacturer. So imagine if more and more manufacturers tie up with their formula, share, if Sputnik shares those formulas with all these manufacturers, there will be even more vaccines. In fact, they believe that India truly is the pharmacy of the world and they will be producing so many vaccines that not just all of India can be vaccinated, but it can be exported out to the world as well. But That is the good news. Let me give you the not so good news here. Again, this is something that could be updated in the days to come. But in my interview with the CEO of Sputnik, he said that they will be ready for manufacturing, in fact, ready to have the jab on the counter only by the fourth quarter of 2021. That means it's only towards the end of the year that we might get Sputnik. So we have to wait and see how this develops. Remember, currently, we're still waiting for the drug controller to give his nod, which is likely to happen. And then we'll all be waiting for the third vaccine in the country. But like I said earlier, and let me repeat that really for you, there is one solution and one solution only to getting ourselves out of this pandemic and achieving herd immunity. That is getting yourself vaccinated. Why is it important to get yourself vaccinated right now? Because right now in the country, a second wave is going on. So please do not wait for one vaccine to come in or hope that something better is on the cards or in the lines. Just get whatever you can right now. We really hope with this, the good news is that manufacturing capabilities will increase and soon every adult in the country can be vaccinated. I hope this was helpful. We'll see you again in the next video.